Hello, everyone. Welcome, and thank you so much for joining us today. I am Amy Loeb. I'm the Executive Director at Peconic Bay Medical Center. And today I am so happy to be joined by Dr. Eric Kokenmeister and Dr. Richard Barakat. Dr. Barakat is our Physician-in-Chief and Director of the Northwell Health Cancer Institute. And Dr. Kokenmeister, a noted cancer specialist and team member at the new Northwell Health Cancer Institute at Riverhead. I am so thrilled to report that we have a Northwell Health Cancer Institute here in Riverhead. What an addition to this community, so sorely needed, and it's bringing a range of new cancer treatment services to the East End. Dr. K, can you tell us a little bit about that?
Sure. Thanks, Amy. First of all, thank you for having me, Dr. Barakat. Hello. As a medical oncologist, we're treating cancers with systemic therapies. And from my discussions with the administration when I started with this job, it was like you were mentioning a unmet need in the East End of Long Island. And we'll get into it later. But I'm a Riverhead native, so I've known that. When I heard about the opportunity to come out, I jumped all over it. So as a medical oncologist, I'm giving chemotherapy to patients for hopefully curative intent, sometimes not for curative intent, but in metastatic patients. But we're offering all services in addition to the surgeons who are already here, the radiation that was already here. So it's a multidisciplinary way of going about caring for our cancer patients in the Riverhead area.
It's so wonderful that you are from this community, recognize the need. This is the most community hospital that I've ever been a part of. And really, just having you as a part of the team is just such a wonderful addition. And I want to say thank you for joining us. It's really such a lovely plug-in. It's the community feel that we can offer, along with the largest, most well-resourced healthcare organization in New York State, and that's Northwell Health. So we have the most experienced cancer team around. And Dr. Barakat, can you tell us a little bit about how the resources of Northwell Health connect into our Northwell Cancer Institute here in Riverhead?
Amy, it would be my pleasure, and I would also like to thank you for having me on today. And I'd also like to say hi to Dr. Kokenmeister again, who is one of our fellows. It's actually a dual homecoming for Dr. Kokenmeister. Not is he only returning to Riverhead, the community he grew up in, but he's also returning to the Northwell family. He was one of our fellows. He trained at Northwell, so we're thrilled that he's joined us. Yeah, so people don't realize that Northwell Health takes care of more New Yorkers with cancer than any other healthcare system. Over 19,000 patients are seen and treated or are seen for opinions in the Northwell Health system. So we're the largest providers of cancer care. We have 9 ambulatory cancer centers, the main cancer centers within the system, and the Northwell Health Cancer Institute oversees how cancer services are delivered throughout our whole system so that we can ensure a standardization of care throughout our system, and that we can bring the most cutting-edge treatments to all of the different populations that we serve. And one of the really exciting opportunities about our healthcare system is we serve so many different ethnically diverse, socioeconomically diverse communities. Staten Island, the highest incidence of cancer in New York, and the eastern end of Long Island, traditionally a community that has not been served with cancer services to the degree that other areas have. And one of the most important things that people need to realize is Suffolk County now has more people than Nassau County. So there are actually a great deal of patients that need to be served. And I think that's one thing that's really exciting about our presence at Peconic Bay Medical Center and in Riverhead.
Thank you. I couldn't agree more. So this is a have your cake and eat it too scenario where we're providing care here in the community, but we are connected to world-class expertise at the Northwell Cancer Institute. So what a blessing for this community. And so our new cancer center is at 896 Old Country Road, which is essentially a stone's throw from the medical center here. Dr. Barakat and I actually walked over there from the medical center just a few weeks ago. It was a little chilly, but it was walkable, certainly. So Dr. K, is that where your office will be? And is that where you'll be seeing patients primarily?
Yes, I'm coming live from the office now. We've been open since early January, and you're right, it's very close to the hospital. If I have patients to see in the hospital, I'll walk from the office to the hospital. I have to walk past Burger King every time I go. Makes it difficult, to pass up. But it's so close. It's such a convenient thing for me as a physician, but I mean for patients, centrally located. It's got major thoroughfares right here. So it's fantastic, and it's been a great experience in this short period of time. So very accessible, and happy to be here.
So I think you have I know you have some other physicians that practice with you within the Cancer Center in Riverhead. Can you tell us a little bit about those?
Right. So that's probably the strongest part about this program, and the thing that I'm most happy to be a part of is that we have all of the surgical specialties. Again, I mentioned it early on in the introduction. A medical oncologist doesn't work alone. You need surgeons, you need radiation doctors, and as a triforce really of physicians to kind of help take care of these complex medical issues. We're lucky enough to have already most of the surgical specialties that we would need in place before I even started. So we have cardiothoracic surgery surgeons who work on the chests for lung cancers, for instance. We have colorectal surgeons, again, for intestinal diseases. We have, Dr. Carpe and his team are surgical oncologists. They are surgeons who work specifically on oncologic cases. So, world-renowned, experts in their fields. Dr. Lee, who does breast cancer, is very well established out here. So, in addition to plastic surgery and almost any, specialty that you would need. So it's fantastic to have them working in this office on select days of the month to help. They can just walk into my office and chat with me about a case, and I can do the opposite to them. And the communication is key, and it helps expedite care for patients and take care of them in the best, fashion that we can possibly do it. So it's worked out very well thus far.
To have a family of experts just operating out of the same office and community, and then being so close to the hospital. I'm really proud of the hospital facility. We just completed a critical care pavilion. Our operating rooms are state of the art. We're actually growing in numbers. So it's just it's a full thickness in terms of services for patients with cancer. So you are, Dr. K, board certified in hematology, medical oncology, and internal medicine.
Mm-hmm.
Can you explain to those who may not understand what that means and how that relates to diagnosis and treatment?
Sure. So I'll start with internal medicine. That's kind of the base level of medical care for internal medicine specialties, which is HEMONC is one of them. To be board certified in any specialty, you have to complete a accredited residency and then take an examination at the end of that time period. So for internal medicine, it's 3 years of training, which again, I did at Northwell, like Dr. Barakat's saying, and took the medical boards to become board certified. That allows you to go on to do more advanced specialty training, and that's where we did the hematology and oncology specialty. Again, another 3 years, so it's a long haul, but there's a lot to know. The difference between hematology and oncology is, I like to put it into terms of solids and liquids. Okay, so hematology is blood disorders. Kind of a unique feature of being a hematologist and an oncologist is that I also take care of benign, non-cancerous hematologic conditions. So anemia, coagulation issues. If people are going to surgery before they're getting preoperative testing and there's a problem with their blood tests that the surgeon's worried about, they can come to me. And it does say cancer on my door, but it doesn't mean that I can't take care of that, because being a board certified hematologist, this is the stuff that we do a lot. At the same time, there are hematologic blood cancers, leukemias, lymphomas, things like that we're very adept at taking care of. And we're very well trained in doing it. And that's the liquid side of things, hematology, which is a very interesting field, and you could spend probably another 3 years of training just for that, specialty. Oncology is the kind of not run of the mill, but the more standard things people think of when they think cancer. I call that the solid malignancies, the solid cancers. So your colon cancers, your breast cancers, things like that, lung cancer, we treat all of them here in the center. And again, that's where we're bringing the specialists from the surgical fields and the radiation oncology that we have next door to help care for these cases. And it's a very rewarding field. It's a fantastic, ever-changing field, and it's really something interesting to be a part of.
Yeah, it's really a privilege to take care of patients, particularly in oncology. I may have shared with you that my background is actually in oncology nursing,
Right.
and so I understand the passion and the love in this field. So thank you for sharing that.
Sure.
Dr. Barakat, so you joined Northwell about 3 years ago, and you are a
Gynecologic oncologist by training.
You joining the health system was huge for us. So
Thank you.
why Northwell?
Yeah, so I am trained as a gynecologic cancer surgeon, and I spent 30 years of my previous life at Memorial Sloan Kettering Cancer Center in the city, and I was the head of the gynecology service for 14 of those. I live on Long Island, and I drove past North Shore Hospital for 30 years, and my wife has been a member of the hospital system for over 20 years. She's a radiologist, practicing radiologist at North Shore. But I was at the point in my career where I had achieved what I needed to achieve at Sloan Kettering, and when this incredible opportunity came up to help patients in my backyard, so to speak, and to really be able to affect a much larger number of patients, it's something that I couldn't turn down. It was so exciting, as I said, to be able to help influence for the better the care of, as I said, we see over 19,000 cancer patients a year, was just an incredible opportunity. The other thing, though, that was really exciting for me is the fact that when you work at a comprehensive cancer center, you're focused primarily on cancer. And we all know that cancer does not occur in a vacuum, that patients have medical conditions. They have diabetes, they have heart disease, they have, other medical conditions, lung disease. And what's really amazing about this healthcare system is that we can provide for the entire continuum of care, everything from screening and diagnosis, all the way through survivorship, through the end-of-life care, which unfortunately we have to deal with. But also, those patients still need their diabetes cared for. They need their heart disease cared for. Cancer does not exist in a vacuum. So the ability to not only help influence how cancer care is delivered, but to also be able to provide the most comprehensive medical care for our patients as our standard for cancer care is just an incredibly exciting opportunity. I've been here 3 years. We've hired over 40 extremely talented people already to join the cancer program, Dr. Kokenmeister being one of them. And we have at least 30 in the pipeline and a lot of really exciting things going on. The final thing that I'd like to say is that we are very close partners with Cold Spring Harbor Laboratory, one of the leading cancer research institutions in the world. Over 9,000 scientists visit Cold Spring Harbor a year. Pre-pandemic, now it's all done virtually, of course, to learn about the most cutting-edge science. And through them, we will be bringing the most advanced clinical trials to our system. And the goal of the Cancer Institute, as I said, is to standardize the care throughout our system so that patients in the Riverhead community will get the best care just as patients in other of our locations will get. So it's a great opportunity, and I'm delighted to be here.
So let me just be crystal clear. So patients who have cancer here in Riverhead could go see Dr. Kokenmeister in the Riverhead office and have access to clinical trials.
That is absolutely our goal. We have hired incredible people, and we are really building up our clinical trials infrastructure. Delighted that Erica Love, who was formerly the Director of Clinical Trials at NYU Perlmutter Cancer Center, has joined us. Dr. Joe Herman from the MD Anderson Cancer Center is the physician lead of our Cancer Clinical Trials Office. We meet regularly with Cold Spring Harbor. We are opening up industry-sponsored trials. We are opening up cooperative group trials and investigator-initiated studies. But we are completely committed to bringing the most advanced care to all of our sites. The other important point about our healthcare system is that we are completely connected. Our medical record is completely connected for our entire system. And if we don't have the access to the type of procedures that we need for a patient in Riverhead, we can easily have that patient treated at one of our other 23 sites. And that's a real advantage. The medical records are intact. The doctors communicate easily and freely with each other. And if we need to have a patient sent to another site for a very advanced surgical procedure, perhaps, or a bone marrow transplant for leukemia or one of the hematologic diseases Dr. Kokenmeister was talking about, we can do that. But for the most part, we think the days of the patients having to get in the car and drive for 2 hours into Manhattan and pay for expensive parking and the inconvenience of family members having to take off from work to get child support, we don't think that's a good model for patients. We want patients to get the care that they deserve in their backyard where their doctors who know them are available and able to care for them as well.
You know, you brought up an important point, and one of the things that we have implemented, and in fact, you know, we're one of the first here at Peconic, is to start with tele-oncology, so that if there is something that is so super specialized that we want to connect with an expert, we're able to do that here at Peconic Bay, and I think that's just, you know, unfortunately, you know, COVID's been tough, but it's also been a really nice accelerator in terms of some of the technology that we're able to use. So that's super exciting. You know, caring for patients across the lifespan, as you mentioned, you know, with cancer becoming more of a chronic disease, we're seeing that. But, you know, we also take care of the entire family. And so our primary care infrastructure here in Riverhead and surrounding areas, the screening programs, as you mentioned, but also our caregiver center here at Peconic Bay, we are able to connect not only with the patient, which is super important, and provide them outstanding care, but also to be able to provide care for the caregivers and support the caregivers, the loved ones who are taking the patients home and helping them get through their recovery. And that's something that I'm really proud of and is truly unique. The Caregiver Center here at Peconic Bay is actually the first on Long Island. And so really proud of that and looking forward to connecting that in. Dr. Kokenmeister, so with your credentials, you too could practice, you know, anywhere. Why Riverhead?
So good question. Again, as I mentioned and alluded to, I'm a Riverhead native. So, you know, throughout training, I've been slowly working my way east, back closer to home. It's just such a great place to live and to raise a family. I had 5 kids, that one of them just born, and my wife's from Riverhead also. We went to high school together. So it was a no-brainer when this opportunity arose. I had a fellowship. Dr. Barakat had just started out of my training. He had just started, and I had been asking around the Northwell leadership, are we doing anything in the Riverhead area? You know, I really like to get out there. I know the Peconic had just become part of the health system around then, and I got no you know hits on that one at that point in time. But so I took another job on the island. But as I heard, I think January or February of 2020, right before COVID, unfortunately, that they were opening something in Riverhead, I jumped all over it because, again, it's why not be able to treat your neighbors and your friends and associates. There's never more than maybe 2 degrees of separation for somebody I know out here. And it's a small enough community and a diverse community. It's actually a bit of a melting pot, which is great.
Yeah.
And a great place to live and work. And I couldn't be happier to be here. It's really been fantastic. In the short time I've been here, it's been wonderful.
That's great. The expertise combined with the heart, which is what you're describing, is what will make us really special. So I believe our cancer center is probably the newest on Long Island here in Riverhead, which is really exciting. Does the center offer any new technologies, amenities, support services that others may not have that we should talk about?
So being new, you have the cutting edge equipment. And now in medical oncology, you don't need much technology on site. You need to have the great nursing staff and caregivers here, which we do, by the way. But really, just the amenities, I think, are probably some of the nicest parts about it. I mean, we have a beautiful 8-bay infusion suite with private rooms and big comfy chairs to sit in during your chemo infusions. Big screen TVs, really nice TVs, actually. You can stop by and watch some television while you're getting your treatment. And all the creature comforts you would want. We have snacks and warm blankets and everything else you would want to be taken care of during a stressful time. I think one thing I would mention is we do have the DigniCap scalp cooling system is an important thing that we want to have available to our patients. It's if people aren't familiar, some chemotherapies cause hair loss, and hair is very important to some patients, men and women, and it does grow back in the majority of instances. But if people don't want to display their bald heads to the world during their treatments, we do have the system that is available to the patients to use on site. It does have a cost associated with it, but again, if you're interested in using it, we have it available. So everything you would need to be as comfortable as you can be during again a stressful time is here, and again with a great staff to help alleviate that stress even further. So a really wonderful facility.
One thing that I noticed as I was touring through the infusion center was not only does it look comfortable, but and allows for privacy and dignity and everything else that's so important to patients. But in our COVID era, it is also extraordinarily safe in terms of spacing between patients who are obviously, if they're experiencing chemotherapy, they're likely compromised. So very important, and I was really impressed by the layout, and actually, and this was designed prior to COVID, but it fits really well in terms of protecting patients during a COVID era. So we have lots of oncology is one of those fields that things are constantly evolving, changing, getting better. It's so exciting. So whoever has something on the tip of their tongue, what's coming down the pike that has you super excited? Something that's about to start, or maybe that's a few years in the making.
Eric, I'll just say one thing, because I have a few things to say. First of all, just because I don't want to forget, Amy, I want to follow up on a point that you made, that one thing that we have to realize is that, getting cancer is a devastating diagnosis, and patients sometimes say, you kind of go through your treatments and there's this frenetic pace. You want to get treated, you want to get surgery, you want to get chemotherapy or radiation, and then you're done, and it's like hitting a brick wall and like, go live your life. Well, there's a lot of things that happen because of those treatments. There are sometimes side effects, or sometimes long-term side effects, and that's what survivorship is all about. And currently in the United States, there are 16 million cancer survivors, and that number is going to increase steadily. We'll have over 20 million survivors soon. We are absolutely delighted that a little less than a year ago, we hired the head of survivorship for the American Cancer Society, Dr. Catherine Alfano, and we are building a world-class survivorship program that will be rolled out in every one of our sites. Dr. Alfano is an expert in survivorship, and we intend to create guidelines that can be national guidelines for how cancer survivors should be followed and how their care should be transitioned to doctors once the oncologic care is done. I think that's such a critical point and part of that continuum of care that we provide. In terms of exciting things from my standpoint, and Dr. Kokenmeister is the expert in medical oncology, but I just wanted to make everyone aware of one thing. I think for the most part, medicine nowadays is moving towards precision therapy. This is where we take a person's cancer, and regardless of the type of cancer, whether it's a colon cancer or a lung cancer, we look for a genetic mutation. We do mutational profiling of the tumor. And then based on their mutational profile, they might be eligible for a new targeted therapy that targets the mutation. And we know that some of these agents have really made incredible differences. An example is in lung cancer, where some of these precision-guided therapies have caused the lung cancer death rate to actually fall now. So that's exciting. But what's super exciting is that the Northwell Cancer Institute has hired Dr. Jeffrey Boyd, our Chief Scientific Officer, who's also a full professor at Cold Spring Harbor and director of the Cancer Research Institute at the Feinstein Institute, our research arm at Northwell Health, to really be the leader of our Center for Genomic Medicine. So we are going to be building a center that will profile tumors from patients throughout our entire system, whether you're in Westchester or Peconic or South Shore. We will have a Center for Genomic Medicine, a molecular diagnostic lab that will do the profiling of those patients, a centralized biorepository to collect those tumors, and also a protocol support lab where we will be informing doctors throughout the system what the mutation is and what the best treatments are in a patient whose tumor has that mutation, no matter where they're treated. And Dr. Kokenmeister will have access to that. We also had our first molecular tumor board, and we're about to have our second one. And this is where doctors from all over the system, we had over 60 people, 60 oncologists participated in the first one. And we presented 5 extremely interesting cases of cancers that had various mutations and discussed collectively as a group what the best treatment would be. And often that's a clinical trial.
I think we lost Dr. Barakat for the time being. I would just to pick up there. He's absolutely right. We have to leverage the genomic data. The gone are the days of saying that all breast cancers are the same or all colon cancers are the same. We have to use our genetic resources to move forward on treatments, and that's part of what he's getting at, and that we're going to have leveraging all those patients that we are seeing and helping kind of move forward to use their data, their genetic information there he's back, to use that information to push forward on treatments. I mean, that's absolutely what we have to do. And why, if you're seeing the most cancer patients in New York, why not use that information to our advantage to help take care of them and improve people's lives? And again, not all cancers are the same. We throw them into a breast cancer, a colon cancer basket, but what's driving them to become cancer in the first place is different for each person. And you have to know the genetic rationale behind why they have cancer. But Rebecca, anything else you were going to say? I didn't want to.
Yeah, I apologize. We're in the era of digital means. The one other aspect of that is all cancer has a genetic basis. And one of the most important things that we teach our trainees and that all doctors should know, and Dr. Kokenmeister knows, is it is absolutely critical to ascertain someone's family history. Did you have a grandmother with breast cancer and an aunt with ovarian cancer and a sister with breast cancer? Well, then you may have a BRCA mutation. So you need to take that family history. What's super exciting is that the Northwell Cancer Institute hired Dr. Noah Kauf, the head of cancer genetics at the Duke Comprehensive Cancer Center, is now the head of cancer genetics at Northwell. And Dr. Calv, in the 1 year has been here, has already hired 8 genetic counselors throughout the system. So all of our sites will have access to genetic counselors because that is such a critical aspect of cancer care. And you don't know that they have a genetic syndrome until you ask. And there's lots of them, those associated with colon cancer, with breast cancer, with ovarian cancer, with pancreatic cancer, with prostate.
Oh, we might have lost him again, but he's absolutely right. Oh, he's back again. Okay, good. Whew. Gotcha.
Am I back?
Yes.
Okay, I don't know what's happening, but yeah. So we will provide all of those genetic counseling services to our patients.
And I would just very briefly just say on a more granular level, oncologically, there's many different, again, specialized treatments coming for particular patients. So one that Dr. Barakat's probably aware of is the CAR T therapy, the chimeric antigen receptor T cell therapy. And I won't belabor the science behind it necessarily, but we're harnessing the immune system's own response to cancer, to abnormal cancer cells, to help kill them. And I believe Dr. Bayer at Monter, the cancer center, has just started opening up that whole process of treating patients for this. It's a very specialized area of hematology, especially. So it's usually leukemias and lymphomas and myeloma, which is another blood cancer that is going to be becoming much, much more common that we see this kind of treatment as we go through time. And they're actually doing studies on this type of therapy in solid tumors too. So that's coming down the line. To be again, to try to personalize it more, again, because traditional chemos are kind of slash and burn, medicines. They take out some of the good with the bad, and we're trying to avoid the toxicity with chemotherapy. There's antibody drug conjugates, which are antibodies that have little molecules or protein molecules that have chemotherapy attached to them, that are like heat-seeking missiles for cancer cells specifically. And those antibodies and drugs get taken into the cell and kill the cancer cells specifically. So we're trying to avoid the toxicity to the rest of the body. So these are all coming. Some of them are actually already around. We have them available at Riverhead. They will be available at all facilities. They're going to become standard of care, I'm sure, at some point. And of course, I think many people have probably heard about immunotherapies, which have been somewhat of a game changer in the last 7 years or so in cancer care, and lung cancer, specifically melanoma, which is again harnessing the immune system to help fight cancer. Cancers have multiple mechanisms of evading detection by the body. This is how they become tumor masses, and these medicines, the immunotherapies, help kind of remove that blanket, if you will, remove the obstruction to the immune system to allow them to kill cancer cells. And I use immunotherapy very frequently in my cancer patients. They're moving up the ladder of treatment options, and many times we use it up front. Yeah. So again, we're doing our best to minimize toxicity. There is still very much a role for traditional chemotherapies, but we like to leverage the personalized stuff when we can. And as Dr. Barakat said, the pills for some of these lung cancer patients, especially, we can give chemo pills, which are amazing in that they do a great job at targeting, again, usually in lung cancers, pretty advanced malignancy and shrinking it away with simply a pill. It's amazing technology, and there'll be more of that coming down the road. And that's why oncology is so amazing, because it's always changing. There's always more data being harnessed and put into practice.
Do you hear me?
Yes.
Sorry about that. I think that is this is so important, to now be delivering CAR T cell therapy. This is such an advanced form of treatment for refractory leukemias and lymphomas, and we're doing it in adults and in the pediatric patients as well. We have an extremely robust bone marrow transplant program, which has just been reviewed again and received really tremendous, fantastic reviews. We are actually going to double the size of our bone marrow transplant program. We just hired our 3rd bone marrow transplanter, and we're in the process of tendering an offer to our 4th. And our goal is to really become one of the premier bone marrow transplant centers around the country. So I think this is great. And again, Bone marrow transplant is very complicated, as is CAR T-cell therapy, and we can't do it at all of our sites, but we do have that site at North Shore Hospital, where our patients from any part of the system can be transferred there to undergo these cutting-edge therapies. So whether or not you do it at one of our local hospitals, you know you have access to doing that, and we will have those patients moved as needed to get some of these really novel therapies that are game changers with patients in diseases that a few years ago would have absolutely not survived.
You know, and going to Nassau County from Riverhead, just to be Riverhead centric, is far easier than crossing the bridge, so to speak, to go into Manhattan. You know, I just, if you don't mind, when I was younger in my career in oncology nursing, I was fortunate to be able to participate in some tumor boards, and you know, I don't know that patients understand the level of expertise of individuals that come into a room to discuss cases and the best course of action. It's such an amazing thing to watch, where you have such passionate individuals in a room who are the most expert and the best around coming together. And now we can do it through the computer. So we even have a more diverse panel of experts and super experts, I'll say. I just think that's something that's very important, that patients understand the level of commitment that we have to making sure we have the best course of treatment for those patients.
Yeah, I'll make a comment on that. I mean, it's the one good thing about COVID has been the telehealth and the electronic resources, because I am out in Riverhead. I'm not near the Cancer Institute and I'm not near Montour Cancer Center, but I have access to the physicians there, and they're some of my mentors when I was in training, and there's world experts there in many different diseases, and to have their ear and to be able to pass cases by them is paramount importance. And that's, no matter who you are, I think you should be having other people take a look at your cases and getting a consensus when there's a question of what's the right choice. And again, it's not just oncologists getting together; it's the multidisciplinary teams. It's the surgeons and the radiation oncologists as well. This triumvirate of doctors that need to take care of the patient. So it's an ultimately great resource, and it's great that we have the technology available to be able to access that, and you're going to get the best care based off of the consensus of multiple doctors in tough cases. I'm confident in myself, but I always like to have other people figure out what they think.
I think that's such an excellent point that you brought up, Amy, because I think patients need to feel reassured. You know, we all, whatever we practice, have a very good fund of knowledge, but, you know, cases are complicated, and it's always great to have multiple opinions. And you're right, Eric. I don't know if we'll ever go back. You know, we'll have in-person meetings, but, you know, when you look at some of these tumor boards, Amy, there are 60, 70 people on them. And this is nurses, social workers, physicians' assistants, geneticists, surgeons, medical oncologists, radiation oncologists. The pathologist is presenting the slides. The radiologist is showing the films. Can all be done electronically. I think, having been involved, Amy, like you said, in tumor boards, I've been involved in tumor boards for 30, 35 years. I don't think they've ever been this good, because there's so many people now that are able to participate. You know, if someone has to drive to get to another facility to attend a tumor board, or they've got, you know, clinic, or they've got other reasons that they can't participate in the tumor board. But now, you know that for this hour, you'll all be online, and you'll see the films, you'll see the pathology, and you'll hear that academic debate that says, okay, look, you may be right, but why not try this for this reason? The patients should feel reassured that they're getting that multidisciplinary buy-in. You know, and maybe it's a decision of whether to operate on someone or give them chemotherapy first and then operate. Those are decisions that can only be done in a multidisciplinary group, you know, because doctors have biases and they may think surgery is the right thing to do, or radiation is the right thing to do. But when it's a team, you're all working together, you're pulling together for that patient to make sure they're getting what we feel is the best and most appropriate cutting edge treatment for them.
It's so important, and I don't know if patients appreciate how much brain power goes into these decisions, and it's really remarkable. So the best kind of cancer is the cancer that never happens, right? And so preventative, and screenings are so important. And we did a study locally here, and it ties up with what we see nationally. Is only about half of people actually go through with the screenings that are recommended. So can you talk a little bit about the importance of screenings and, even in the COVID era, how, people are afraid to go to the doctor? I think that's loosening up a bit. We're seeing people are becoming more confident in the ability to go, but talk to us about the importance of getting your screenings on time.
I can mention in a global view, and then Eric, maybe you can talk more on the local, what's happening on the ground. We don't want cancer to become another victim of COVID, because that's actually what was happening. And if you look at the National Cancer Institute's modeling study, they took two cancers that are commonly screened for, breast cancer and colon cancer, and they predict 10,000 more deaths from those two cancers over the next decade because of patients not going for screening. And we have to get that message out. We have to ensure their safety, because you need to have your colonoscopy. You need to have your mammogram. You need to have your pap smear. We need to screen for these common cancers, because we don't want cancer to become another casualty of COVID.
Yeah, I'd second that. I mean, I've personally seen, and I know colleagues have seen, patients who've put off their screenings, and unfortunately it ends up leading to more advanced cancers, and those are harder to take care of course. We'd rather you not have any cancer ever, and not every cancer can be screened for, but those that can, and that's it, like you mentioned, is colon, breast, cervical, prostate in men, lung in smokers, of the appropriate age. Not a 20-year-old shouldn't necessarily be screened for all these things, but it's a key component of cancer care, because you don't want to have to see me. To be honest, I'd rather see you on the streets somewhere, hanging out. You don't want to have to see a medical oncologist. So that's been a big problem with the coronavirus infection, and it was, I think, a little bit more of an issue earlier on in the spring last year, but it still is lagging behind. I think we got to get people in to get their screenings, and it's safe, and it's something that's really important to do.
So we're coming into March, which is Colon Cancer Awareness Month, and I think colonoscopy is the message for March. Get your colonoscopy if you haven't. So if somebody has a finding on a screening, does it necessarily mean they have cancer, or is it sort of, talk to us about, God forbid there's a finding on a screening?
So the far majority of screening tests are not cancerous. Okay, they are really designed to make sure that we can catch the people who are truly negative, that they don't have the disease, if that makes sense. So you occasionally will find patients who have something of questionable significance on a mammogram, for instance, and that may lead to a biopsy, maybe in about 10% of mammograms of all comers, but a very small fraction of percentage, probably even, of those biopsies will be cancer, actually true cancers. Colonoscopy is the same way. It's maybe, I was reading data, maybe about 40% of colonoscopies will remove a polyp, but a very small percentage, a fraction of that percentage will be leading to a cancer. So, but they've been shown in studies, these interventions have been shown to improve survival. We don't ever want you to get an advanced cancer. So again, Colon Cancer Awareness Month is coming up, and I think many people are scared of doing colonoscopies, but I think really the preparation is the hard part, doing the drinks, but the day of, it's not a huge deal. And here at Peconic, we have great GI doctors, and they'd be more than happy to walk people through it. And just to stay ahead of it, that's always what I tell people: make sure this never becomes an issue. And I tell cancer survivors of breast cancers that there's no reason why you can't theoretically have a colon cancer, and vice versa. You want to take care of all of your possible issues. And most cancers are sporadic. People say, I don't have a family history. Well, it's not necessarily the case. There are cancer syndromes, but somewhere around 70 or 80% of cancers just happen from these genetic changes that we're noticing. So it's imperative that you get these screening tests done, no matter what your standing in life is. It's if you're of age, you're 45, 50 years old, get a colonoscopy, and hopefully it'll be clean, and you can do it again 10 years later and not worry about it.
And that's what the power of an integrated healthcare system like Northwell is.
Mhm.
We have that army of internists, of gastroenterologists, of urologists that can do those screenings. And I think that's what's critical, that we enable patients to have access to that. Specifically with regard to colorectal cancer awareness month. One of the sad things that we're seeing is that the people 45 and above, now that the American Cancer Society lowered the age of their recommendations, are going for their colonoscopies, but we don't tend to screen younger people for colon cancer. You don't think of colon cancer in a 30-year-old. What's unfortunately happening, though, and we're not quite sure why, it may have something to do with dietary factors, use of whatever antibiotics, changing what's called the microbiome, the bacterial milieu inside the colon. What we're seeing is an increase in colon cancer in younger patients, and most of the time they are not necessarily patients with a significant family history where you expect to see it in younger patients, but they often do have relatives who may have had abnormal polyps. And we really need to make sure that if there are patients who are, even if they're 30 and they have got relatives who have these abnormal types of polyps that can lead to cancer, they should really be looked at for screening. We've got to try to figure out why these younger patients are getting, because the incidence of colon cancer in younger adults is increasing. It's been highlighted in articles in the New York Times. It's known in cancer statistics. So it's not just the classic group of patients that we think about, but we've got to try to come up, because unfortunately, if you get colon cancer and you're in that younger age group, you're much more likely to have advanced stage disease. So it's something that we need to have a heightened awareness of and think about, especially during March Colorectal Cancer Awareness Month, to get that message out. And we'll be putting out a public service announcement about that.
So for those who are listening, if you have a family history of abnormal polyps, and you should talk to your doctor about that. And if somebody is diagnosed with cancer, I'm imagining a very difficult time where you can't even think straight, and then you have questions, and how do we support that process?
So I can speak to that. So it's the most trying time is that period between diagnosis and the plan. I tell people, that's that middle of the night wake up. What's going to happen to me? And there is always, unfortunately, there's that period. There's a couple of days before you can get in to see us after that diagnosis to settle that plan. And it's hard to deal with for patients. But I tend to tell patients that once we get that plan, once we have the final staging, once we have all our ducks in a row, we can give you that treatment plan going forward. That would hopefully, it makes me feel a lot more comfortable and confident in what we're going to do, and I hope it provides some reassurance to the patients. And again, I think, as we're alluding to, there are many survivors of cancers. We're getting much better each year, each month at treating cancers, and it's something that we can hopefully cure in many patients with the appropriate staging, but also in those who we can't cure, maybe metastatic, spread cancers, we hope to turn it into chronic diseases at the worst, where we can kind of maintain and preserve some quality of life and give some good impact on the cancer care. So it's a scary time, but again, you have a lot of people in your corner, as we've kind of alluded to during this whole thing. There's so many different people who have vested interests in taking care of you. And I think I should also mention social work, dietitians. We mentioned the genetics counselors. Even if they're not on site here at Peconic, we have, again, vast network of people we could refer to, over the phone now or over the internet. So it's really a wonderful time to be able to take care of these patients. And it's a scary time, but we can help you, walk you through it. And the large majority of people do very well for a long time, and that's what we're aiming for.
So navigation is also, I think, a critical piece, and we've committed to that here, where, if someone has a finding on a screening, we've got you.
We have, our own practice nurses who help guide patients through the process. Again, it's so complicated. I start talking to you about cancer treatments and what scan you have to get done, what biopsy you have to do, and it can be overwhelming. And to have a navigator who can say, here you go, this is the paper, you go here on this day, is such a blessing. And we have a clinical coordination center that's a kind of centralized service that, we can get people in to get echocardiograms or, what have you. Anything that we need to do to kind of help support our treatments can be set up very quickly. And we just mobilize our giant health system to kind of help take care of people as fast as we can. So again, there's so many resources that we have for patients, and it's we make it as palatable as possible during a tough time.
So I'm going to ask each one last question, and if there are any questions that are coming from our audience, please, do feel free to ask those questions. We'd be happy to answer them. So Dr. Kokenmeister, any words of advice for people here on the East End who want to make sure that they or their loved ones get the absolute best cancer care?
Sure. So of course I'm biased being a Northwell employee, but again, as we mentioned, being a North Forker myself, it's the city tends to start at the LIE more or less when we pick up on the expressway, and people don't want to have to go far to do anything. So I again can't stress enough how nice it is to have a cancer center. And again, I am biased being a member of that center, but it's to have options and have the leverage of a big health system is really a blessing. And again, you mentioned it to yourself, Amy, that we can have a community feel, but take care of you in world-class, means. And there are options out there. We all know there's other cancer centers, et cetera, but I don't know that anyone can offer the same kind of almost academic feel to how we take care of people in a community setting. It's really a tremendous plus for East Enders, North and South Forkers, and maybe a little bit west. We'll go into Manorville, Wading River, sure. But it's really nice to be able to offer those services to people.
Yeah. We've got the best of both worlds. Yeah. And Dr. Barakat, if someone wants to learn more about cancer prevention, symptoms, treatments, what resources do you recommend? Oh, we lost.
I think.
You're good.
I think one of the. Sorry about that. I'm having internet issues. I think one of the. We have a lot of resources within the Cancer Institute at our different sites, but a good source most patients go to is on the internet is the American Cancer Society. We do a lot of work with the American Cancer Society. As I said, Catherine Alfano from the American Cancer Society. Mm-hmm. But the American Cancer Society does a great deal in terms of community outreach, in terms of education. So I really think looking at the American Cancer Society, looking to them on their website for information is a great place to start.
Great. So I will just close out, unless Victoria, there are any questions. I'll just close out by saying thank you both. I am so proud of what the Northwell Cancer Institute is accomplishing, and how quickly it's growing in just these world-class experts. This community deserves that level of care. And it's just, I'm so happy that we're able to provide it. Dr. Kokenmeister, welcome home. We're so glad that you're here with us, and get your colonoscopy if you haven't. Everyone who's listening, please. We're happy to help you with that. We have amazing physicians, and and really just know that if cancer becomes a part of your life, we've got you.
No questions from the audience, guys, but I just want to, again, for any of our listeners, for more information, please visit Northwell.edu/Riverheadcancer. And the phone number for the Cancer Center is 631-846-5200.
Thank you all so much. We'll let you get back to doing your very important work.
Thank you
Thank
so much
you.
for having us.
Thank you. Take care.